Ealing Community Partners has had a really successful first year, bringing together 750 staff and delivering over 100,000 episodes of care for the people of Ealing. Our intention was to show that working in partnership benefits patients, carers and their families, and we're trying to improve the standard of care that people are receiving, as well as delivering it more efficiently. We're now going to hear from a few people who've been directly involved in delivering Ealing Community Partners.
Ealing Community Partners, since its start 12 months ago, have improved the way we provide community services to the residents of Ealing. Their nursing teams are completely embedded with Ealing primary care networks and GP practices. Through the COVID pandemic, they have worked collaboratively with all the acute and community providers and primary care in Ealing to provide joined-up care. They have developed innovative ways of delivering care, including video consultations, and I look forward to working with them to deliver improved care for the residents of Ealing.
One of the things I'm most impressed about is that Ealing Community Partners has established a referral hub that's now receiving over 13,000 referrals every month. And what this does is it helps simplify our community offer to the primary care networks and GPs we work alongside, and the many thousands of patients, relatives and carers that we support within the borough.
We now have a referral hub for community services. So for me, in podiatry, that means that we can refer directly instead of having to go via the GP.
Patients and clinicians have benefited from the information technology, reliable devices to work remotely, patients' houses.
It's like a one-stop shop, so the patient is the centre and the patient's getting everything that they need, rather than them being 3 different or 4 different appointments, different times, places. Now they come to one place, it's all looked after right then and there.
We know that 17% of ECP patients have accessed more than one service. Now, in my view, that is definitely the best approach, so that they get a streamlined, joined up service where they're not going from pillar to post.
Over the last year, Curie have really enjoyed being partners with Ealing Community Partners. We deliver care in our rapid response service and our care home service and community to residents and patients in Ealing. We've really valued being included as part of the voluntary sector in what is a really exciting time in integrated care systems.
We work with multidisciplinary team members in collaboration with each other, and I think that really is helpful for the patient as well whenever we need to make any referrals or make decisions about patient care.
I've really noticed that actually we're working a lot more collaboratively. Certainly from my perspective, being an inpatient therapist, we worked not in isolation, but we looked after our own ward. What we're doing now is we're trying to look across the 3 wards and making sure that we're working across and cross-covering. So I think that's been a really good improvement that we're looking on building on, that I'm trying to do in my new role.
So that was a flavour of what ECP has been all about and how we're working together to develop services to support local residents. Before we go, we thought it would be useful to get a view from a national perspective to see what other providers in a similar sector are doing.
When I look at what you are doing in the partnership, absolutely covered all the national plan areas, and I would just encourage you to carry on doing that and work in your local partnerships and get that right for your local communities. When the COVID time has finished and we're able to get out and about, I'm really delighted to come up and see and hear from you directly what you're out and about. And of course, I would thoroughly encourage you to write up what you're doing, to record the real benefits of how you achieved what you are doing, so we can learn both in London and we can learn across the country. Well done, team. Well done for all that you're doing, and please carry on doing the great things for the benefit of local residents.